Hi, I am Nicky Cameron, founder of Emergent Counseling and Consulting. I'm also a holistic trauma resolution therapist. And I'm here this afternoon with Dr. Lauren Decicco. Thank you for making space to have a conversation with me.
Yes, my pleasure.
Of course. So Emergent Counseling and Consulting we've decided to add more specialty services targeting nervous system. We'd like it to be. And we want to ensure that when you, our current clients or potential clients, are here with us, we are providing you with quality support. And so I recall this particular client that I had that I sent over to you at the time, Dr. Lauren. She was bedridden, severely depressed. We had been doing therapy, and at a certain point, I realized that what I was offering was just not going to be sufficient. This woman could not function. The only thing she was making it out of bed to do was to use the restroom. And so I referred her to you because I know that your specialty is in touch work, right? And that's the piece that we don't offer here, hands-on movement or touch work. So help us to understand, what is it? How can the work that you're doing, well, tell them what your role is in your specialty. How can what you're offering aid our clients that we're serving and maybe other clients in the community who are struggling with severe depression, severe anxiety, PTSD, or even bipolar disorder?
So my specialty is I am a doctor of physical therapy, and I approach care through a holistic approach, really targeting the nervous system, because the nervous system is the main controller of all things healing for us. And you can see that on the side of a mental side and a physical side. It controls everything. And when we're dealing especially with things like a history of trauma, or how we start to manifest physical symptoms from what we've experienced emotionally and mentally, we get stuck in a state of survival. And what I do is I go into the actual body and I signal safety to the body so it can send that message up to the brain and allow us to transition out of that survival state into a healing state, and so that we can move forward in our healing process. So when we're trying to work with a mental health therapist, that feeling and sensation of safety inside of our nervous system will allow us to push forward in our processing of different histories and things like that, so that we can get a little bit further in what we're doing. And when you talk about what that patient was experiencing as far as being shut down and frozen in the healing process, her nervous system was just so scared to move forward that to protect itself, it shut itself down. So going into the body and telling the body it's safe through different touch therapy and movement patterns that I do with people, helped that patient pull out of that freeze response and that shutdown response enough so that she could come back into therapy and continue moving forward. And now she's a very thriving, functioning
she's doing really well.
So the combination of doing the body work, the bottom up with the top down, has had such greater outcomes.
And we also offer things like EMDR therapy here and brainspotting. And while those modalities are very effective, sometimes there's more needed, right? And we see a lot of clients that we've also worked with and we've referred to with insomnia, individuals with like fibromyalgia, right? Or severe anxiety. And I guess because insomnia is one of the major issues that we see a lot of individuals struggle with, and stomach issues, what can you offer to that in terms of someone who is in therapy and they maybe have changed their diets and they're feeling stuck, they're having a lot of gut issues or sleep issues? How can your work, or how does your work complement what we're doing in therapy?
So because those are all side effects of your nervous system being stuck in a state of survival, you're not going to operate as far as, you're not going to go into that rest and digest state easily. So that's where sleep happens in the state of the nervous system, that sleep and proper digestion from the moment you eat until you excrete your food out is all related to being in that safety part of your nervous system. So doing the approach to care through the nervous system to help people pull into that rest and digest state will stimulate those normal processes, those what should be automated processes. Even the sleep process is an automated process, but we can't easily go into it because we don't necessarily feel safe. So doing some certain body works, I do things to stimulate parts of the system to pull you into that rest and digest state. But I also teach the client to do it for themselves. So when they're at home in their environment and they're getting ready for sleep, we work on transitions into sleep and doing some different movements and self-stimulation to the nervous system to prep the body for that state as well. And it's really helped. Like the goal would be we have more nights where we're sleeping than we're not sleeping, meaning reflecting that we're in that more regulated state of the nervous system. So the more regulated we are, the better sleep we get, the better our gut issues are. Even if you've done gut protocols with maybe a medical provider, the effect of that protocol will be much more enhanced by regulating your nervous system.
And another common thing we've been seeing here at Emergent that we're working with is TMJ. A lot of our clients struggle with TMJ when they're coming into us, and I'm curious as to how you might address that.
So really common tension holding patterns and pain patterns with people that have dealt with chronic years of stress or trauma. Or dealing currently with any sort of like anxiety or anything like that, that they're, it shows up in the body as clenching, bracing. So a lot of hip pain, low back pain, gut issues, difficulty with getting a deep breath because the diaphragm is really tight and restricted, shoulder and neck tension, which goes into TMJ. Because our first responding muscles to a stress sort of stimulus would be clenching and bracing the shoulders and bracing the abdomen and hips for a protective mechanism. So those are very, very common holding patterns and complaints that I see with people that have dealt with years of chronic stress and trauma. And so doing, again, nervous system regulation is always first, but to help encourage the tissue tension to release and help with the pain cycle that's going on. I offer a lot of different modalities. I do a lot of hands-on work, cupping. I also do dry needling to help release the soft tissue. So that's using acupuncture needles to actually go in and allow the muscle to unwind and release.
Got it.
So there's a lot of soft tissue modalities that help to encourage the relaxation in the body.
And so if someone's saying, well, maybe I don't want to do talk therapy right now, but my body, I feel stuck. I feel like I'm not moving forward, which I'm glad that came to mind because we have professionals here. They're overachievers and they were doing really well. And then something happened that's caused them to feel stuck. Is that something, burnout, a lot of burnout. Is that something that you help with, that you can help them to pull out of that feeling stuck and lazy? I hear a lot of, I feel lazy, and I'm trying to explain to people, talk about what functional freeze might look like. Versus, is it really laziness or is it that we're frozen and our nervous system is trying to slow us down?
I think it's, in my opinion, I believe that it's always your nervous system protecting you. And it starts to get wired as more of a habitual response the more we sit in it without addressing it. But so again, it's going into the nervous system and pulling you out of that functional freeze. So teaching the body that it's safe and it doesn't have to protect itself, then all of a sudden people start to become a little bit more motivated because they're sitting in a little bit different part of their nervous system. But I do work with high level athletes, professionals, people that are under chronic pressure to perform all the time and tend to go into they do all of their day-to-day stuff, but then when it comes time to like have some enjoyment or be at home, they just kind of like sit in bed, don't do much. They like get through the day great, but then they're not motivated to do much else. They're not really wanting to like socialize. They don't feel creative, joy, engagement. They're just kind of coasting through. And so again, addressing and learning to balance your nervous system a little bit better. So it's healthy to have stressors, but it's not healthy to stay in that stress all the time with no balance or recovery. So reteaching the nervous system how to flex on and back off and rebuilding that into your day-to-day lifestyle so that you don't end up in shutdown or burnout.
Okay. That sounds great. And I can attest to it. Dr. Lauren will tell you I refer family members to her. And the great thing is that you can show up here at Emergent for therapy and see Dr. Lauren right after or vice versa. So if you or someone you know could benefit from Dr. Lauren's services or the therapy that we offer, please reach out to our office. You can dial 954-533-4828. And our client engagement specialists, one of them will be happy to assist you.